No one wants to think about their beloved cat growing old, let alone reaching the end of their life. But as painful as it is, understanding the signs of aging can help you provide the best possible care for your feline companion in their final years. In this video, we'll go through 12 key signs that indicate your cat is aging and may be approaching the end of their life. Stick with us until the end, because we'll also share a vital tip on how to make your cat's final days as peaceful and pain-free as possible. Now, let's begin. Sign number 1. Loss of appetite. One of the first and most concerning signs of aging in cats is a sudden loss of appetite. While it's normal for older cats to eat less due to a slower metabolism, a drastic reduction in food intake can signal serious underlying health issues. According to a study published in the Journal of Feline Medicine and Surgery, loss of appetite in senior cats is often linked to kidney disease, liver failure, or even cancer. As their organs begin to weaken, their ability to process food diminishes, making meals unappealing or even painful. Veterinarians often warn cat owners that dental disease is another major reason older cats stop eating. Imagine trying to chew with a severe toothache. Inflamed gums, loose teeth, and oral infections can make every bite unbearable. If your cat suddenly refuses food, try offering soft, warm meals and check for signs of discomfort like drooling or pawing at their mouth. But here's the crucial part. A cat that stops eating for more than 24 hours is in danger. Prolonged fasting can lead to hepatic lipidosis, a fatal liver condition. So, if your aging cat is skipping meals, don't wait. Seek veterinary advice immediately. And keep watching, because the next sign we're about to discuss is just as critical for your cat's well-being. Sign number 2, extreme weight loss. If you notice your cat getting thinner despite eating normally, it's a major red flag. Extreme weight loss in aging cats is often linked to serious medical conditions like hyperthyroidism, kidney disease, or even cancer. A study published in the Journal of Veterinary Internal Medicine found that over 60% of senior cats experience significant muscle loss, known as sarcopenia, as they age. This natural muscle deterioration makes them appear frail and bony, even if they have a normal appetite. Hyperthyroidism, a common disease in older cats, causes the metabolism to go into overdrive, making them lose weight rapidly despite eating more than usual. On the other hand, chronic kidney disease, one of the leading causes of death in elderly cats, results in muscle wasting and dehydration, leading to noticeable thinning, especially around the spine and hips. Veterinarians recommend high-protein, easily digestible diets to help maintain muscle mass. Adding omega-3 fatty acids and vitamin B supplements can also slow down weight loss. But here's the key. Sudden weight loss is never normal. If your cat is shedding pounds fast, it's time for a vet visit. And keep watching, because the next sign might reveal why your cat isn't as active as they used to be. Sign number 3, lethargy and lack of interest. Has your once playful and curious cat suddenly lost interest in their favorite activities? Lethargy is one of the most telling signs of aging and can indicate underlying health problems. According to research from the American Association of Feline Practitioners, AAFP, senior cats experience a natural decline in energy due to changes in metabolism, joint health, and cognitive function. However, severe lethargy is not just aging. It's often a symptom of something more serious. Chronic illnesses like kidney disease, heart disease, or feline diabetes can drain a cat's energy levels, making them sleep excessively or avoid movement altogether. If your cat is spending more time hiding, avoiding social interactions, or sleeping in unusual spots, it could mean they're in pain or experiencing internal discomfort. Veterinarians also warn that feline depression and cognitive dysfunction, cat dementia, can make older cats appear uninterested in their surroundings. To keep your cat engaged, try gentle play, interactive feeders, or soft bedding in their favorite spots. But remember, a cat that barely moves for long periods needs urgent attention. If your cat's lethargy seems extreme, a vet visit is crucial. Stay with us, because the next sign could explain why your cat isn't grooming like they used to. Sign number 4. Changes in grooming habits. Cats are naturally clean animals, spending up to 50% of their waking hours grooming. But if your senior cat has stopped grooming, or their coat looks unkempt, greasy, or matted, it could be a sign of aging-related health issues. According to a study published in the Journal of Feline Medicine and Surgery, older cats often reduce grooming due to arthritis, obesity, or cognitive dysfunction. Arthritis makes stretching and twisting painful, causing your cat to neglect hard-to-reach areas. If you notice dandruff, matted fur, or an unusually greasy coat, joint pain may be to blame. Similarly, overweight cats struggle to groom themselves properly, leading to hygiene issues. Cognitive decline can also make a cat forget grooming routines altogether. Veterinarians suggest regular brushing and gentle cleaning to help senior cats maintain hygiene. If your cat resists touch or reacts with pain, it's time for a vet check. Unkempt fur, combined with bad breath or excessive shedding, could also indicate kidney disease or a weakened immune system. Ignoring grooming changes might mean missing an underlying illness. Keep watching, because the next sign may explain why your cat's breath suddenly smells worse than usual. Sign number 5. Bad breath and dental issues. If your senior cat's breath suddenly smells foul or rotten, it's not just a minor inconvenience, it's a serious warning sign. According to the American Veterinary Dental College, AVDC, over 70% of cats develop dental disease by age 3, and the risk only increases as they age. Gingivitis, tooth decay, and infected gums can make eating painful, leading to weight loss and malnutrition. But bad breath isn't just about dental hygiene. It can also signal kidney disease, diabetes, or even oral cancer. A strong ammonia-like odor might indicate kidney failure, while a sweet, fruity smell could be a sign of diabetes. Veterinarians recommend regular dental checkups, soft foods, and dental treats to help manage oral health. If your cat is drooling, pawing at their mouth, or refusing to eat, it's time for a vet visit. And stay tuned. Our next sign could explain why your cat is struggling to jump or walk like they used to. Sign number 6. Difficulty walking or jumping. Have you noticed your cat hesitating before jumping onto the couch or struggling to climb stairs? Difficulty walking or jumping is a common sign of aging and joint deterioration. According to the American Association of Feline Practitioners, AAFP, 90% of cats over 12 years old show signs of arthritis, even if they don't limp or cry out in pain. Arthritis, hip dysplasia, or spinal degeneration can make every movement painful and stiff. You may see your cat walking slowly, avoiding high places, or sleeping more due to discomfort. Overgrown claws from reduced activity can also make walking painful. To help, provide soft bedding, pet stairs, and joint supplements like glucosamine and omega-3 fatty acids. Heated blankets can also soothe aching joints. But if your cat appears in constant pain or stops moving altogether, a vet visit is crucial. Up next, why your cat might be meowing more than usual, especially at night. Sign number 7. Increased vocalization. If your senior cat has become more vocal, especially at night, it could be a sign that something is wrong. Aging cats may meow excessively due to confusion, pain, or anxiety. According to the Cornell Feline Health Center, many older cats develop feline cognitive dysfunction, FCD, similar to dementia in humans, which causes disorientation, forgetfulness, and increased nighttime vocalization. Medical conditions like hyperthyroidism, hypertension, high blood pressure, or chronic pain can also trigger excessive meowing. Hyperthyroidism, in particular, makes cats restless, anxious, and constantly hungry, leading to loud and persistent meowing. If your cat is suddenly crying at night, yowling for no reason, or sounding distressed, consult your vet. To help calm them, try nightlights, a heated bed, or pheromone diffusers. But don't ignore this sign. Persistent vocalization often signals an underlying health issue. Sign number 8. Confusion or disorientation. If your cat seems lost in familiar surroundings, stares blankly at walls, or gets stuck in corners, it could be a sign of feline cognitive dysfunction, FCD, often referred to as cat dementia. According to the Journal of Veterinary Behavior, over 50% of cats aged 15 and older show signs of cognitive decline, including confusion, memory loss, and disrupted sleep-wake cycles. Senior cats with FCD may wander aimlessly, forget where their litter box or food bowl is, or appear startled by familiar people. They might also cry out at night due to disorientation or increased anxiety. To support a cat with cognitive dysfunction, veterinarians recommend consistent routines, brain-stimulating toys, and supplements like antioxidants or omega-3s. If confusion worsens or your cat seems distressed and detached, a vet visit is essential. Sign number 9. Changes in litter box habits. If your senior cat is missing the litter box, urinating outside of it, or struggling to get in and out, it could be a sign of aging-related health issues. According to the American Association of Feline Practitioners, AAFP, older cats often develop arthritis, kidney disease, diabetes, or urinary tract infections, all of which can make using the litter box difficult or painful. Arthritic cats may avoid the litter box if the sides are too high or if it's located in a hard-to-reach area. Cats with kidney disease or diabetes may urinate more frequently, leading to accidents. Cognitive dysfunction can also cause confusion about where the litter box is. To help, provide low-sided, easily accessible litter boxes and place them in familiar locations. If accidents continue, consult a vet. Eliminating outside the litter box is often one of the earliest signs of serious illness. Sign number 10. Labored breathing. If your senior cat is breathing heavily, panting, or struggling for air, it's a serious warning sign that requires immediate attention. According to the Cornell Feline Health Center, labored breathing, also called dyspnea, can be caused by heart disease, lung disease, fluid buildup in the chest, or even cancer. Unlike dogs, cats rarely pant, so if you notice open-mouth breathing, rapid breaths, or wheezing, your cat could be in distress. Heart disease, especially congestive heart failure, can cause fluid buildup around the lungs, making every breath a struggle. Lung infections, asthma, or tumors can also lead to breathing difficulties. If your cat's gums appear pale or blue, it's an emergency. Seek veterinary help immediately. To help, keep your home calm, quiet, and free from stress. But remember, labored breathing is a life-threatening symptom. Next, why your senior cat might be withdrawing and hiding more than usual. Sign number 11. Withdrawal and hiding. If your senior cat is spending more time hiding under the bed, in closets, or avoiding interaction, it's often a sign that something is wrong. Cats are instinctively wired to hide their pain and weakness, so withdrawal can indicate illness, discomfort, or emotional distress. According to the American Veterinary Medical Association, AVMA, older cats with conditions like arthritis, kidney disease, or cancer often retreat to quiet places to cope with their pain. Cognitive decline can also make cats feel confused and anxious, leading them to isolate themselves. If your once social cat no longer greets you, avoids touch, or hisses when approached, they may be in distress. To help, create a safe, quiet space with soft bedding and gentle reassurance. But sudden or prolonged hiding is a red flag. A vet visit is crucial to rule out serious health problems. Next, the final and most heartbreaking sign: your cat no longer responds to you. Sign number 12. Seizures or unresponsiveness. One of the most distressing signs that a cat is nearing the end of its life is seizures, or sudden unresponsiveness. According to the Cornell Feline Health Center, seizures in senior cats are often caused by brain tumors, kidney failure, liver disease, or neurological disorders. You may notice twitching, convulsions, drooling, or sudden collapse. Some cats also become completely unresponsive, staring blankly, not reacting to touch, or failing to recognize their owners. Seizures can be short and mild or severe and prolonged, status epilepticus, which is a medical emergency. If your cat experiences a seizure, keep them safe by removing nearby objects and keeping them calm. But if your cat is frequently having seizures or is completely unresponsive, it may be time to consult your vet about end-of-life care. This is the hardest part of pet ownership, but knowing the signs can help you provide comfort in their final days.